My name is Liam O'Mahony, the Director of Communications for Niagara Hospice. I'm joined today by Jane James, Registered Nurse and Director of Admissions at Niagara Hospice. Since 1988, Niagara Hospice has served patients and families and caregivers across Niagara County, treating the patient and family as one unit. Niagara Hospice provides specialized care, supplemental therapies, and personalized support to families faced with any type of late-stage illness with a prognosis of approximately 6 months. For Medicaid-only patients, they are eligible for a diagnosis of 12 months. The variety of diagnoses that Niagara Hospice cares for include heart disease, emphysema, kidney disease, cancer, Alzheimer's disease, and other dementia conditions. We encourage questions to be submitted for future podcasts by emailing us at information@niagarahospice.org, or you can add your question as a comment to the podcast post on our Facebook page. For this podcast, Jane James will provide an overview of how the referral and admissions process works for providing care and support for patients and families as soon as possible when they choose hospice care. Thank you, Jane, for joining us today.
Thank you for having me.
Who can make a patient referral to Niagara Hospice?
Anybody can make a referral to Niagara Hospice. If you're a concerned neighbor and you notice that your neighbors have maybe had some more frequent illnesses, hospitalizations, so you can be a neighbor, a family member, your primary medical doctor, really any relation to a patient, whether it's friend, family, or any physician or any member of the medical team. Anybody can make a referral.
How does the patient referral process work once someone makes the call for the initial evaluation?
We try and reach out to the person that made the referral immediately and try and set up something. Once we get the call from them that they think their loved one or their friend may need hospice services, we ask a few questions and then we'll reach out to the family member if they're able to take the phone call, and we'll try and set something up that day. Usually we like to get to them the sooner the better.
And how long can it generally take between the first call and the admission being complete?
Most times it all happens in the same day unless it's a family request to maybe request a certain day. But most times we get a phone call, whether it be from a hospital or a patient's family, we try and get there within a day or the same day.
Great. If someone is not yet eligible for admissions after the evaluation, how does the hospice staff follow up with the patient and family in the future?
Well, there's a couple things we can do. We can ask the patient if they're okay with us calling them and checking in maybe monthly with them. We just like to try and keep a close eye on them to see if there's any changes. Most people are receptive to that and don't mind us calling and seeing how they're doing, just as a courtesy. Another thing we can do, we have a palliative care program called Pathways. And Pathways is excellent really at following patients and doing monthly nursing visits. So if they're not quite meeting criteria for hospice, Pathways deals with a lot of patients that have end-stage illnesses. And they keep an eye on the patient and direct communications with the physician. And if there's a problem, they'll let us know.
Great, thank you. What if the patient's primary care physician doesn't want to sign off on admissions? Can they still be admitted if the patient and family feel it is the best option?
Yes, best case is that the physician does agree, and most times they do. Most times the referrals even are coming from the patient's primary physician. But yes, we usually reach out to them because Medicare requires 2 physicians to certify that a patient is terminally ill. So one of those physicians is our medical director, Dr. Castaldo or Dr. Anna Gavriluk. But we do require another certification as well, and it can be from the patient's primary doctor, or maybe they have an oncologist, maybe they have a pulmonologist, just as long as we have another physician that agrees, yes, this patient is ill and could benefit from hospice services.
Great. And how does the Niagara Hospice staff stay in touch with the primary care physician once the patient is under the hospice program?
We do keep pretty close contact with the primary care physician throughout the patient's hospice stay. Our physicians and pharmacists We'll make recommendations for medications if the patient's experiencing symptoms, but we'll always call the patient's physician, who they've chose as their attending physician, to actually order the medication. So we are keeping in contact with them. Upon admission, we're usually faxing them our note, their admission note. So we do keep pretty close contact and let them know how the patient's doing throughout their stay.
Excellent. If someone improves and needs to be discharged back home, would they still be eligible for future admissions to the program?
Yes, that has happened before. Maybe some patients have stabilized once they've come under our care. They've actually improved a little bit and stabilized, and we've had to discharge them. And then maybe down the road, a year or so later, we've actually had them come back to us. So yeah, that does happen sometimes.
Last question for today's podcast. If someone lives in another county, but their family or caregiver lives in Niagara County and they want to be closer to home and choose Niagara Hospice, can they be admitted to the program, or do they have to choose the hospice in the county where they live?
That's a good question. So most times when we receive a referral, the hospitals are pretty good at recognizing where the patient's home address is. If they're in Erie County, the referral would then go to Buffalo Hospice. If they're in Niagara County, the referral would go back to us. But we have had some circumstances where the family member may be in Erie County and maybe they live in Erie County, but their family members and their children live in Niagara County and they want to move in with them, and that is perfectly fine.